And welcome back to Adjusting the Game, episode 19, Chiropractic Risks, Reality versus Fear. I'm joined here with everyone's favorite padre, Dr. Andre Grasa. Welcome. How are you?
Welcome, children, and all those that have come to the spreading of the gospel that is Adjusting the Game. I am very well, thank you. And yourself, Dr. Kukumu?
No complaints at all. Very excited about this topic. We were actually technically requested, informally requested, let's go with that, to discuss this topic. Shout out to the Italian Stallion. And pretty excited about it. It's something that we've repeatedly, a topic we've repeatedly abused over dinner. Some of our mates, I think, are probably, you guys can skip it. You've heard it all. The rest of you, absolutely be ready for it. It's going to be action-packed. And talking points we're going to discuss: is chiropractic dangerous? We're going to discuss social media. We're going to discuss a whole lot of things because there's a little bit of distortion of reality out there. And I'm actually seeing this more and more in practice. Quick example, 2 weeks ago, 3 patients in a row. And to be honest with you, I don't think I've actually told you this. I thought you were pranking me. Honestly, I thought you were pranking me. Okay, so first patient walks in, pulls out a video, says, I've seen this video on TikTok. It says you just need my neck and my blindness will be cured. I kid you not. So then I go, okay, listen, this is not how this works. I'm so sorry to be the bearer of bad news, but, going through this whole thing. Anyway, out the patient. Next patient walks in. The very next patient, Monday morning, walks in. And this is where I started getting suspicious, right? I've seen this video on YouTube, and it says, you must just click my neck, and my sense of taste and smell will come back. So at this point, I'm smiling, and I'm going, are you serious? And she's dead serious. And I realized, ooh, I opened the practice door, and I'm kind of half expecting some Mexican with a stash and a camera crew, because I thought, seriously, like 2 in a row, like one is maybe like, okay, normally. Anyway, same thing explained. Listen, don't want to be the bearer of bad news. The third patient, and I kid you not, guys, I cannot make this up, walks in. She says she's partially deaf, a little bit of a balance issue. Okay, all right. But she pulled out a video and she's like, this guy in the States is saying that you must just click your C0, C1 and your deafness will just be gone. Again, I opened the door because at this point I was like, seriously, someone's pranking me. It has to be. And that's kind of led us partially to this topic and the timing of this episode. And I'm very excited.
Yeah, but you see, the big problem with that is that people think that we went to Hogwarts. Unfortunately, we actually went to real chiro school. Yeah. It's called Fontaine in the middle of Joburg. So we actually get taught evidence-based chiropractic. And we're very, very hype on about this quite a bit. So as Tristan's kind of very much alluded to, today we're generally be talking about something that comes up a lot in chiropractic, but generally, let's be honest, in healthcare, just across the board. And that's risk. And let's not dodge it. Let's not fluff it. Guys, chiropractic care is not risk-free, but newsflash, no form of healthcare is. If you're afraid of risk, healthcare is the wrong industry for you to go into, FYI. And I feel like the real question isn't, is there risk? It's how much risk are we actually talking about? And how does that compare to any other options that might necessarily be on the table? So before we go any further, I feel like it's very important to define risk properly. Because I feel like in order for us to kind of grasp exactly what it is that we're trying to get across in this entire conversation, we need to kind of get this across. And that is, risk is not just the possibility of something happening, okay? Risk is the probability of something happening, so a certain outcome, multiplied by the severity of that outcome. And this is where people, I think, get it slightly wrong. They hear about something rare but serious occurring and assume that it's likely. Rare doesn't mean impossible, but it also doesn't mean likely. That's important to keep in mind for this entire discussion. So we're going to try and obviously stick to the major risk factors that generally Tristan and I deal with on a daily basis, specifically obviously in a chiropractic context. But it is worth mentioning that you do tend to get kind of two brackets in terms of common risk factors, necessarily something like post-treatment soreness, which we'll kind of get into. And then you get the more serious ones, which you guys would have honestly heard about. So Tristan, take us away, bro.
Okay, are we going to go like quick fire rounds? Just run through them. I'm joking. We'll go slow and steady. Okay, so the big ones, and this is the most, if you go on any Reddit chat, any comment section, basically, this is going to come up with chiropractic, and that's strokes. And it's very rare. We'll give you the stats later. We have the receipts. Do not worry. We will send you all the research. It'll be somewhere in the description later on. Strokes, big one, rare, but they do happen. The big thing here, there's nuance to this, is in most of these cases, and this is kind of the summary of the whole topic or the whole episode today, is these patients were already having stroke symptoms. They're already coming in with a headache, with neck pain, and the chiropractor or chiropractors failed to identify that this person was already having a stroke. So that's a big one. Another one is neurological fallout. Spinal cord injuries, also very rare. I know there was a big case in the States about a year or two ago. That comes in with technique selection, with cowboys, with how aggressive are you going to be, with get into it again, some treatments, and what is a treatment and what is a trend online. And then the next one, the big one, rib fractures. Okay, that kind of comes in a little bit more with your elderly population, your population that has brittle points, osteoporosis, osteopenia. And again, screening comes in here. Again, being a little bit too aggressive, you need to be specific about your technique selection here. And then another common one is obviously dry needling risks, especially in South Africa. Of course, in the States, the chiros aren't really trained in dry needling, so don't really have that. But infections are real, guys. It was, unfortunately for a South African chiropractor, an influencer had posted a video of them getting needled through clothes. And yeah, safe to say is, yeah, it didn't go down well. Infections are real, and also pneumothorax, ping a lung, guys. That's very much a real thing with the upper trap and kind of thorax area. So those are kind of the big risks. Are there anything that I missed?
Actually pretty safe to just actually dive straight into the big one. So I'm going to try to take it away straight with the one that obviously we get asked about the most, which is when we talk about adjustments and regulations, we're speaking about one specifically, and that is the neck adjustment. And obviously its correlation with strokes. So specifically, there's something called cervical artery dissection, which is basically when we're doing an adjustment, sometimes you can have a little tear on the inner lining of the blood vessels. Now, what Tristan was alluding to beforehand is often people will have these cervical artery dissections or other forms of symptomatic stroke-like conditions before they even walk into them. There is an association in several studies between chiropractic visits and strokes. But here's the important part. That same association exists with visits to general practitioners. Okay? Because early symptoms of developing dissections, stroke-like symptoms, often include and are associated with neck pain and headaches. You guessed it, a lot of those people walk into our offices. So people go looking for help because of the symptoms they feel. Very important. Correlation does not equal causation. Blaming chiropractic for every stroke after a visit, or any chiropractic that might necessarily have had someone in the office that subsequently lands up falling victim to a stroke, is like blaming an umbrella for rain. They show up at the same time, but they're not the reason it's happening. There is cases of poor clinical reasoning, which we'll obviously get into, but it's very important to remember the risk of a serious adverse event from a cervical adjustment exists, undoubtedly, but it is extremely low. I think the estimated risks, so we've gone through quite a bit of literature, and guys, if you actually pointed, and we will attach said literature to the show notes, it ranges quite a bit from different papers, but generally, you're looking at about 1 in 100,000 treatments to 1 in several million manipulations, depending on the study. A commonly cited middle ground figure generally tends to be around 1 in 1 in a million. So to put this into context, you're more likely to be struck by lightning twice than to have a stroke from a neck adjustment.
Jump in on that. Is that per chiropractor?
So most of the studies that I read were actually down to each manipulation. So to put it related down to each manipulation. And then there were others that did it per treatment. Now, the one, interestingly enough, with the ones per treatment, didn't list how many manipulations were done in said treatment. So I did see there was a difference in terms of guys quoting it was in said treatment, and whatever was done in that treatment was not necessarily disclosed. It was, yes, they were adjusted. It didn't necessarily say specifically what adjustment or what part was adjusted. And then you had the ones where like, cool, X amount of manipulations. So there is varying ways, obviously different in terms of presenting the equations or presenting the statistics.
I'm with you.
Yeah. And I think it's, again, so like you're seeing these adverse reactions to something that's incredibly serious, but I need you guys to kind of take a step back here. Again, what we mentioned beforehand, right? Anything in healthcare has obviously a risk to reward ratio. When we look at medication, for example, which carries risks like gastrointestinal bleeding or cardiovascular issues, or even surgery, which carries risks of infection or serious health complications. But we still see both very accepted and widely used to great success. Why? Because they are utilized when it's appropriate. Good clinicians don't eliminate risk, they manage it. And in this particular case, this is no different.
Yeah, absolutely. And I mean, let's quickly discuss what actually increases the risk. Like, what is a good clinician? And as you already nailed it, is poor screening. Coming in, and I mean, I don't know about you. I mean, I know you do, but every patient that I come in, if I'm touching your neck, I'm doing cranial nerves, I'm doing a screening, I'm seeing like, are you busy having a stroke? Do you have strength do you have grip strength? Simple basic things that you think, whatever, we just learned this for an exit OSCE. Those things come in handy. And I've had, luckily, touch wood, no issues with that. I've had some other things called equina and stuff, but that's more the lower back. But, it just also makes you more confident going into your session. It doesn't, again, there's no zero risk, but there's a managed risk. And you explain to the patient what you're doing. And there's also that confidence now from the patient in you, going like, oh, this person is being thorough, taking their time. These 5 minutes in and out sessions without doing any screening, any history taking. That's where that increases the risk. Where you're coming in, what's sore, or you don't even ask what's sore. You just click everything you can, off you go, see you next week. And it's this repetitive thing. And no one's done their due diligence. That's what makes it dangerous. And unfortunately, these chiropractors, these guys are running into problems because they're putting themselves in those situations, but also unfortunately the patients. And the big thing is we see these 5-second clips or 10-second clips on social media. And this is what's happening. Patients are seeing this and they're going, oh yeah, I want that click. Oh, this paid actor had such a great response. They started crying. It was beautiful. I want to do that. You're not necessarily a candidate. That's why we're here. That's why there's a profession. And as much as there's debate, people swear by chiros, others hate them, we wouldn't be here. We wouldn't be recognized by medical aids if there wasn't some merit for us to be here. And our job is to identify there's a complication here. There's a red flag here. This person is not a candidate for this technique or this manipulation or chiropractic at all. We need to refer. I mean, in your exit OSCEs, you've got this medical emergency refer. Like, it's not just for the exit OSCEs. You need to know, listen, this guy's face is drooping suddenly and, the speech is slurring and luckily I work next to a GP, so I would never have to panic ever. But, these are things that we're trained to recognize. But now your barber's hitting clicking your neck. You're like, oh, listen, I'm kind of speechless. It's like, yeah, no, I'm a really good barber. Send you off home. That's why we're here at the end of the day. So we have to consider, patient factors, proper screening, proper history taking, identifying red flags. Is this patient a candidate for, firstly, chiropractic, secondly, the technique you're selecting, and the technique choice. And unfortunately, young chiropractors are being influenced by the social media. I've felt this pressure. I mean, I'm sure you have as well, where they come in with a video, Y strap, And they're like, can you do this? I'm like, I'm sure I can, but I don't want to get sued and I don't want to hurt you. Firstly, don't hurt you. Secondly, don't want to get sued. Um, but this are the things, and there's those pressures as a young car. You're trying to make it. You really want to, not please the patient, but you want a good result for them, a good outcome for them. And remember that you want a good outcome. You don't want to please them. They associate that video with, I'm going to get better. You can show them a better way. And that's why we train. That's why we have a 6-year degree. That's why it's a master's degree. That's why you have to do endless amount of paperwork in clinic, because when you're in practice, it really just goes fast and wild.
Yeah, dude, 100%. Clinical responsibility and decision making. That's honestly what it comes down to. And that's pretty much encapsulates exactly what you're saying, right? This is where the real responsibility essentially of a clinician comes down. And that is, a good practitioner doesn't just jump into treatment. As you've mentioned, we've got certain indications or contraindications to using certain tools. Thorough history, screening of red flags, assessment of neurological, vascular signs, tools that we as clinicians should be using or would like to use are decided on a case-by-case basis, depending on what that patient walks in. The patient doesn't necessarily decide or will decide on what they're going to be needing for this particular treatment. That's what we study for, guys. We study an incredibly long time to accumulate this knowledge and to be able to spot those signs and make those critical decisions on what you need in order to get better. The adjustment or dry needling is no different. It should not be a reflex. It's a decision. A good clinician doesn't just ask, can I do this? They ask, should I do this? And sometimes just because you can doesn't mean you should. We also need to separate the idea of the tool from the person using the tool. I think this is an important point to make, because the tool isn't necessarily the problem. It's how, when, and if it should be used that's incredibly important. Walking to a chiropractor and getting adjusted every single time with no sense of screening, no questions asked, is the same as walking to a surgeon's office and being booked in for surgery before they've even met you. It sounds a bit odd, right? That's not healthcare. That's enthusiasm license. Like, you need to be watching out for that shit. And this is where things get a bit irrational for me, because blaming an entire profession necessary for a poor clinical decision is like blaming all chefs because one guy served you a really crappy steak once. We don't have a chiropractic problem or an adjustment problem. We have a bad decision-making or clinical condition deciding problem. Every profession has them across the board. Unfortunately, they don't come with warning labels. So I get asked this quite often, and it's honestly a fairly simple answer, but it is really true. Guys, making informed decisions on who you're essentially trusting your healthcare with is very, very important. It needs to be someone who is well qualified, has the evidence-based practice behind them, has necessarily a good reputation, and that you inherently trust. And this is where I'd like to bring up the whole conversation of evidence-based practice versus outdated thinking, which is very important in our profession, I feel, because we need to be honest about the profession itself, guys. Speaking to chiropractors specifically, there is a lot of outdated shit, okay? A lot of outdated models and explanations that are still floating around. And it gets in my tits a little bit, I'm not going to lie. Ideas that don't hold up when we actually look at the evidence, in my opinion, modern evidence-based chiropractic should focus on evidence-based driven manual therapy, movement, load management, rehabilitation, all the good stuff that I feel inherently makes a good, well-rounded clinician. Good healthcare isn't about pretending risks don't exist. That's something you're going to hear me interesting pop on about a lot of this. It's about explaining it clearly and making sure that patient understands what they're getting themselves into, pros versus cons. But we'll get down that whole little rabbit hole towards the end, because I feel like that'll kind of encapsulate everything that we necessarily want to be bringing into to kind of make sure that you guys are on the page of what I think really the main message is going to be walking away from all of this. But another big one that obviously we want to chat about, because, and Tristan rightly mentioned, it's very specific to us in a South African context, because not every other manual therapist will necessarily do that, especially overseas, in a chiropractic context, and that is dry needling. So dry needling is generally considered safe when performed by properly trained clinicians, but like any invasive technique, it carries risks. The most notable and serious complication is something called a pneumothorax, which is basically when your lung collapses due to air creeping into the space between your lungs and the chest. Dramatic. I know, it's crazy. Particularly when you're needing anything around the thorax, upper traps, or like rib cage, anything like that upper back area. the reported incidence of something like this happening is incredibly low. It's not zero, but it's very, very low. And almost always linked to poor technique or inadequate anatomical knowledge. So basically just poor training. Can I just put this out there? Clinicians make mistakes. It happens. Okay. It's incredibly rare as well. So in other words, the needle isn't the problem. Again, necessarily the tool. Most often, the person holding it might be. With proper training, careful patient selection, and awareness of anatomical boundaries, the risk remains rare, very manageable. Like most things in healthcare, it comes down to the clinician again, using clinical reason, not just technical skill. To give you an idea of the risk of getting a pneumothorax from getting treated with needles, it's estimated, again, slightly varies with literature, but roughly less than 1 in 100,000 treatments, likely even lower in skilled, well-trained professionals. So again, to put that into context, you're more likely to get injured driving to the appointment than from the needle itself.
Yeah, it really does put it into perspective. And I'm again gonna hammer on clinical reasoning and decision making. And as you said, that's kind of what it all boils down to. If there's very, very, very skinny individual in front of me, I tell them straight, I don't have the appetite for this risk. I'm like, I can work with my hands. It's not invasive, get the same outcome. I can almost see your lung pulsing through there, the apex of that lung. I don't want to be poking needles there. And again, there's that pressures again for young chiros coming in. Also patients listening in. You do have an influence on the chiropractors, and we have to kind of sometimes stay strong and go like, listen, this is not the best decision for you. This is not the best treatment for you. And a lot of patients will come in to a GP and say, no, I need antibiotics. And it's like, no, you need a whatever else it is. You need a life update. I don't know, whatever it is. But you can't come into a practice and go to a professional and you go in there spending time, spending money on this professional, but you're not willing to hear them out or, accept their professionalism, which you are paying for. So that's a big thing. And like you said, if you are uncertain at all as a new chiro or anything, play it safe. I always kind of, in my head, if I'm making a decision, I always go, if I cannot tell a patient, this is why I'm doing it, this is the risk, and that we're going to get to the consent, well, let's just jump into it right now. Consent is key, right? In all the ways of life. And with us, informed consent is key. There's a difference, guys. Sitting with a patient, explaining to them, listen, I'm going to needle your upper trap. Your apex of your lung is quite close to that. Okay. I'm trained to avoid it, to not hit it, and do it like this. And this is the way it's going in. You're just going to chill. There is a risk. They have made an informed decision and said, you know what? I'm happy with that. Carry on. I trust you as a professional. Even if they don't trust you, they say, oh, listen, I don't want to do it. It's nothing new. It's not personal. It's just they don't have the appetite for that risk. And that's important. And that's okay. And another little thing is if the patient is scared of needles, right? Why would you then go and needle them? Because now they're tensing up even more. And now there's an increased risk now suddenly of them twitching or jumping up, panicking if they're scared. So these are, again, clinical decision-making can really lower the risks of chiropractic, of any healthcare or any treatment modality.
Yeah. Good healthcare isn't about pretending risk doesn't exist. We've mentioned that. It's about explaining it clearly enough that the patient doesn't feel like they're signing a mystery contract. The patient should be educated not only on what their issue is, what the diagnosis is, but how we're treating or going to fix it and why, so pros, cons, and essentially where it's relevant. The patient is trusting us to make those right decisions because we are the trained professional today. They're coming to us. And it's just as important knowing when not to treat. If there are red flags, neurological deficits, or a suspicion of a vascular issue, again, we are trained to spot those things. You don't push forward. I'm a huge fan in following your guts. I'm speaking to the clinicians out there. Sometimes inherently, I can tell you many times, and I'm sure Tristan's found himself in the same position, where you'll do the necessary tests and they pass with flying colors, but there's just something in their history that you turn around and you're like, this just does not sit well with me. And I cannot tell you, I tell a lot of the students that I work with, the amount of times that has saved my ass properly. And where does that come from? It's just clinical reasoning. That's what we were trained to do, is to pick up those small little signs, even when necessarily tests aren't pointing in the right directions, using that clinical reasoning and trusting it. It's about making the right.
And where does that clinical reasoning come? It comes from your training and trusting in your training and backing your training and backing yourself. You spend a lot of time doing these things. And if I can give you an example, 2 weeks into my private practice career, picked up a quarter equina syndrome case. I mean, the rarity of that is I mean, I remember them giving us the stats and I thought, no way. I won't ever see that. 2 weeks in, this lady gets up. I see there's a puddle of water on a seat. And I go, that's interesting. Hey, by the way, have you bowel bladder issues? Oh, actually, there we go. Emergency referral. And again, just that gut, talking, there's a lot going on. You just go, like, something's off here. Something's off. You just got to fall back onto your training, which is really, really good. I mean, I've treated chiropractors from the UK, from Australia, from Dubai. I've spoken to osteopaths. I've treated osteopaths, physiotherapists from international. And the standard of training that you get in South Africa is second to none. I can tell you that. You should not be stepping back for any other country. And unfortunately, there are very, very good chiropractors in the States, but unfortunately, ones that we are seeing are the TikTok influencers and the guys that are trying to kind of pretend that there's zero risk and 100% upside to these things.
Yeah, absolutely. The best patients don't start with what can I do to this patient. They start with what does this patient actually need. So we're not trying to necessarily appease the patient when they come in here, like Tristan's mentioned. They said, oh, listen, I'm here to get this particular adjustment. I'm here to get this particular treatment. Guys, again, back your training, which Tristan's mentioned. We study for a very long time, and I back him through and through when he says that our training on this side of the world is second to none. I really and truly believe that we leave qualified well above the standard that we get out there throughout the world. And we are taught how to essentially assess and work through some very problematic cases in an incredibly evidence-based and constructive way, which is why we carry largely the reputation that we do. And the bottom line for me, quite frankly, is chiropractic care is generally incredibly safe, just like any other manual therapist out there. It can be very effective in neuromusculoskeletal conditions, but it's not without risk. And that's okay. Because I believe the real conversation isn't chiropractic versus other forms of care. It's good practice versus poor practice, speaking specifically within a chiropractic context. The danger isn't the adjustment, it's poor decision making. The danger isn't dry needling, it's poor decision making, period. And when you hear a lot of these adverse reactions, again, look, mistakes are made out there. You get that across the board in healthcare. People don't necessarily like speaking about it because it makes you very uncomfortable, and it's true. But at the end of the day, you are dealing with humans, and very rarely just the wrong call will be made. But that is literally, I can't exactly give you a stat on that because there isn't really one, but it happens, right? But the large majority of adverse reactions, which already are incredibly slim, come down to decision making. If there's one thing that I feel like you could walk away from this entire episode with, it's very simply be cautious of fear-based narratives because there's a lot of them, but also be cautious of blind reassurance. You're getting a shit ton of that, especially on social media. The truth usually sits somewhere in between, in the middle. And that's where good healthcare honestly exists. Healthcare often is not black and white, guys. I wish it was, but we're dealing with an incredibly complicated system. The human body is stupid complicated. There is a lot of gray in between. And that is where you need to work with a clinician that you trust.
Mic drop moment, honestly. Again, there's really not much. I think you've nailed everything. Don't let social media distort reality. Don't get sucked into the conveyor belts. Just keep coming. Do it properly. Most of the times, unfortunately for patients, I think the guys that are probably worth your while are probably going to be more expensive. But, it's your health. You don't mess around with that. And if it's a decent clinician, yeah, we'll figure something out. I don't think finances and anything should ever increase your risk of treatment. And a good practitioner or good clinician is always gonna put your health and wellness before your wallet. So I don't think you should ever stress about that. And if it isn't the case, then maybe you're not in the right place where you need to be.
And, you just made me think of something now. I don't know if you ever get patients that will turn around to me and they apologize for asking questions or asking really a lot of questions. And I turn around to them and was like, guys, I love questions. Hit your questions under the sun. Like, let's go, let's rock and roll. Because if I can't explain to you what I'm doing and why I'm doing it, that's a problem. That's a red flag for me in terms of the patient to the clinician. If you're turning around and you're not necessarily happy with the answer and they can't break down that answer for you as to why they're doing X, Y, and Z, or why they think X, Y, and Z is going on, taking a bit of a step back and being like, am I in the right?
And without as you said, fear-based, oh no, you need to come back and and as you said, outdated stuff. And it's our job to get the outdated stuff out of the way and put the new stuff. As much as we complain about it, we have a platform and it's our responsibility as chiropractors and clinicians to go and be like, hey, listen, actually, things don't pop in and out. That doesn't work. As terrible as it is to have that conversation, I had this patient yesterday, and after the 10th time of like repeating myself, and he's just he has this thing in his head that this thing is like off, and it can't be right. And I said, if that is the case, you're not in the right place. You need to be seeing a surgeon. And it is so difficult because he's watched this chiropractor, on YouTube in the States. He's got millions of views, and he says, but people are flying all over the world to go see this guy. And that is his measure of safe or risk. And this is, as I said, it's a terrible conversation to have, especially with like the examples that I've given you, the blindness thing, all that. You feel like an absolute criminal because a lot of the times people come in, you're their last hope. We're still seen as alternative medicine in some places. They've gone to the ENT, they've gone to the physio, they've gone to the GP, the specialist. No one can help them. So it's like this outdoor, like this out there idea is, oh, let's go to a chiropractor. It's a great responsibility and a great privilege to be in this responsibility, to be able to add value to people's life and really. You might not be the one directly helping the patient, but you might help be that little course correction and send them onto the right way, because they might have been thinking they've got this heart problem for 2 years, may or may not be an actual patient. 2 years, pain, heart problem, spent an unholy amount of money. It was a rip. And, and it's not like, oh, it was in or out. It was literally just, it was the craziest thing. And just because I said, hey, these things don't pop in and out, it doesn't make sense. And I just sat down and educated the patient. And there you go.
Dude, it's something I've been criticized for, and I can almost guarantee you've been criticized for it. People, I'm going to just go out and say that other professionals, specifically chiropractors, have accused me of necessarily going down the narrative that they believe is pulling away from what pure chiropractic is, and that we give the profession a hard time. Guys, it's because Tristan and I are so passionate about the profession that we push so hard, especially on other chiropractors, because we just need to be doing better. It's that simple. We, as Tristan mentioned, are very privileged that we find ourselves on a platform we can get this sort of information out far and wide. And in dealing with the patients that we do on a daily basis, we also take it seriously because I love the profession. I truly do. And I see where the profession is, and I feel like we could just be doing better. I'm not saying we're not doing a fantastic job. I really do, but there is a lot of room for improvement. And I want to do, and I feel like every other profession should be doing the same thing to be pushing us in the right direction. I've been criticized by patients, even by a patient that comes in that might necessarily want to be adjusted. And I say, listen, you're in the wrong place. Unfortunately, I can do a lot of different things. Here's my toolbox, right? The adjustment is one tool inside that very big toolbox. I think it's outdated. And again, I'm probably going to get in shit for saying this one, but I think it's outdated for chiropractors to identify themselves as just the people that necessarily adjust. That's gone. That narrative for me is gone, because that is, our profession is so much more than that. So when someone comes into my office and they're expecting to be adjusted, that's going to be my call. As we've mentioned here, we're the one that's going to be making that call, making the decision when that's what you need. And if that's not what you need, I'm not going to give it to you, because my job is to make sure that you get better. And whatever I necessarily decide that course of action is going to be, and I'll be more than happy to explain it to you, that's the way that it's going to be. And if that doesn't necessarily include manipulation, that's going to depend on what you come into my office with. And I feel like that's the direction that our profession should be heading into. We don't just purely identify with just being a manipulative therapist. We're not just that. We're so much more. I feel like it's degrading to our profession to turn around and be like, but you're a chiropractor, you must adjust. Just throw that adjustment in there. But why? If the treatment protocol is already good, if I'm doing exactly what this patient needs, why do I just need to throw that in there? Why do I need to feel that pressure to be able to turn around and be like, no, but I have to do it because I'm a chiropractor? That is not the way it is. That's like saying that I'm a surgeon. I have to open this patient up. They're perfectly fine. I've done the cortisone injection. I've done this, but I must cut them. I must do it. What are you going to turn around? You're going to turn around to that surgeon and be like, dude, what's wrong with you? Same thing. In my idea, it's the same thing.
Yeah. Yeah, exactly. I mean, I've had some American chiropractor slide into my DMs and my comment section very upset. And, my argument is just fair enough. There's, I think, seven schools in the States that still teach subluxation. Like, that is their model. The rest only speak about it. The rest of the world in the courses, they only speak about it as like, oh yeah, we used to believe that, back in the day. And another little argument that I'll throw in there, which I've seen on Reddit. I like to read the Reddit things. And someone said, oh, but chiropractic was found by, this, and they were believing this and that. But if you look at the timeline and what medical, mainstream medical was still doing lobotomies at the same time. So like, yeah, it is crazy, but like we've all, and this is the point that Andy's trying to make and saying like, we are so much more. It's moved completely away from back crack and that's it. Come in, click, click, there you go. And you are doing a disservice to your patient. That is you. That is 5 minutes in and out. And not just a disservice, but you're putting them and yourself at risk. And in South Africa, you have absolutely zero excuse to be practicing 5 to 15 minute sessions, just clicking, because you were not trained like that. And we will keep you accountable. And that is one big thing that I absolutely love about Joburg and the chiros there, because you're all on top of each other in like that central area, and you guys are sharing patients, because then you're all busy and then this one's busy. And the patients talk to each other, or talk to the chiropractor and say, oh, but this guy did this and that. And I can tell you now, let's name drop, if our boy Dr. Hutchison is doing some dodgy things in Bryanston, and the next day or the next week or whatever, that patient is at Dr. Andy's rooms, guess who's getting a call? I'm using Dr. Hutchison because we'd never do that. He's the upstanding citizen in chiropractic.
I'm a normal chiropractor. I'm just putting this out there. That boy has treated me more times than I'm carrying to. But I check. Right out, big boy in Bryanston, he's insane.
Yeah. But point is, there will be a call. The same with if I'm messing around here, patient goes up to Joburg and he's seeing them, there will be a message. It'll be an uncomfortable call. Like, hey man, this is what the patient's saying. What's happening? And there's a little bit of like accountability brewing in Cape Town. And the more of you qualified, newly qualified and graduated chiros, the more of you come down here, the more there's a responsibility network down here as well. And to keep each other not being Karens, but saying, hey man, there's a standard, and this is what we're doing, and helping each other. Have a quick call. Hey man, this is what's lying right in front of me. Help. And at the end of the day, it's about the patient, not your ego. As much as I've had patients here come in, and I've just realized that this is not a case for me. It's not a case for a chiropractor, and you always focus on the outcome and for the patient. What is the best patient outcome? Because then that's truly where you start getting a good reputation and a successful practice, is where I'm going to go to Dr. Andy, because whether he will directly sort me out, he will send me to someone else to get me sorted and still indirectly help me, because I trust his clinical decision making. Don't want to just get clicked. I want to get better. You don't need to adjust every patient that walks in just because you can. Doesn't mean you should.
I had a student with me recently that I was chatting to, and they brought something to my attention because they happened to actually be observing in my rooms. And I got a patient that came in, and without giving too many details away, basically they came in and they were a heavy neurological case, which we can deal with. But this I believe to be a little bit more than what I could deal with at that given time. And before I could work with the patient, I felt like they needed to be in someone else's office first. So I needed to explain to them why I was going to be doing an incredibly limited treatment. I was actually referring them off to go and see. And then they were hopefully going to come back. So you should meet certain standards before they come back to me, which I explained to them. So I then essentially got in contact with the other physician, happens to be a neurologist, explained the case and referred the patient on. So that student brought it to my attention and said, do you not feel like you've failed the patient because you can help them? And I turned around and I said, how did I not help them? Please explain to me how I didn't help them. I said, the student's fantastic. I think it's just from a perspective of they've just got a little bit of kind of growing to do and understand. I can understand what they were trying to say in the sense of, but you didn't physically help them. And I'm like, yes, I did. Again, I used my clinical reasoning to understand that right now I need to take my ego and put it aside and understand that this patient needs more than what I can offer to them right now. And I need help. Remember, we're always putting our patients first. And if I feel part of the greater healthcare system, that there's something else out there that's going to help them more than what I can help them now, it is my duty as a physician and a clinician to refer them out. That is something that I feel like we forget, not even just chiros, guys. This is across the board. We sometimes let that ego, and we said that in other episodes before. And this recently came up as a question, which is why I'm just kind of throwing this out there. We need to understand that putting our ego aside is super important when we're dealing with patients, because at the end of the day, one wrong call like that can put a patient down a very dark path. And you could have been the person who could have flipped the switch. Again, coming back to that narrative, there's so much more than just someone who's just going to kick you.
Please let us know what you think about the YouTube videos. We're now officially on YouTube. Look, our day jobs are chiropractors. So, bear with us. We're getting into it. We're learning a lot. Give us some feedback. Can you watch it? Can you watch the whole thing? Do you want more of that? Do you want more audio? And then we'll tweak it to your liking.
So we're going to wrap it up there for today. If you guys have any questions, as always, you guys can pop us a message. Thank you for all the 1 or 2 messages that we got from one of our fans that are super glad to be back up. Subscribe, share. That's how this message gets out, guys. We really appreciate it. And as before, if you guys ever have any requests, please feel free to get in contact with us. We obviously have anything that we can necessarily address or have for certain topics in the future that you guys will enjoy. See you next time, guys.